I'm David Mason, the Director of Public Health for the town of Sandwich, and it's Monday, July 12th. And as with the summer proceeding, as far as myself and Joanne Geake, the public health nurse, we wanted to give a summer health update because there's various topics we'd like to discuss and trends we're seeing. So today we have with us Joanne Geake. How you doing, Joanne?
I'm doing fine.
So we wanted to talk because you were saying in one of our meetings that you're starting to see a lot of tick disease cases occurring in town. So we want to make people aware of this? I mean, we're coming off COVID, people are outside. Yeah. So, and we're seeing an alarming number really compared to past summers.
We're seeing more than just Lyme disease of the past. There's a lot of black-legged ticks out there, which is the deer tick. That's tick number 1 here, causing problems. And that tick causes anaplasmosis, Lyme disease, and babesiosis. And anaplasmosis is our number 1 tick-borne disease in Sandwich over the last 6 weeks.
Okay, that's unusual.
Yes.
And at some point we'll have just a picture describing the ticks, just so you can compare your American dog tick or the wood tick to the deer tick. But as far as and with that tick-related disease, what type of symptoms are people seeing, and are you seeing anyone hospitalized?
Yeah. With both anaplasmosis and babesiosis, we're seeing people hospitalized. The symptoms, unfortunately, are really close to COVID symptoms. People start out usually a week to a month after having been bitten by a tick. And that's another point. Most people now have not found a tick on them. They don't even know they were bitten. So the symptoms are a fever in anaplasmosis, up to 104 degrees, headache, achy muscles, chills, loss of appetite, sometimes nausea and vomiting. And they are so sick that they need to go to the hospital. So either they go to the emergency room and they stay, for 12 hours to be hydrated, or they're admitted.
Okay. So what are you seeing for numbers total in town this year?
Right. So far I have 10 in 6 weeks. That's this past 6 weeks. 10 anaplasmosis, 5 babesiosis, and 7 Lyme disease.
Okay.
Now the Lyme disease patients, I don't have to call them anymore because we have so much Lyme disease. So the state doesn't need notification. But anaplasmosis and babesiosis, I do. So I talk to all of those folks to see what the symptoms are and if they're on the proper medication. So
again, how that process occurs, I mean, we just came off COVID with contact tracing and notifications of disease. With the deer tick diseases, as you've mentioned, other than Lyme, you get you receive notification from who?
I receive the culture reports from the State Department of Public Health. And out of those culture reports, I usually have a phone number. I call those folks up to see if, number one, they know that they have a tick-borne disease. A lot of these folks have not been to their doctors. They're only in the emergency room, and the emergency rooms are busy. So I look, I'm trying to make sure that they're not folks who have fallen through the cracks, still feel sick, are not maybe on the correct medication.
So why do you think then we're seeing so many cases this summer compared to the past?
Well, first of all, the tick-borne illnesses are creeping up over the years. Nobody's quite sure why. And there are different varieties of ticks. Now we're seeing the Lone Star tick coming up from the south, which causes a few diseases here. But for the most part, people are outside now. They are more than happy after COVID to be out working in their yards. And I think they forget that, tick-borne illnesses are really serious and you can be very sick. In fact, one of the illnesses, Powassan, which is a viral illness carried by ticks, the deer tick, can kill you. And we've had 2 deaths in the past several years from Powassan. The problem with that disease is there's no treatment for it. Mm-hmm. It's not a bacterial infection, so you can't use the regular medications, and there's nothing for this type of viral infection.
So we have people out working in the yards
Yep.
more so, and people with pets, because I've mentioned to you in the past,
Right.
I have 2 English pointers with majority of white, and I've always said to you,
Thank
boy,
heavens.
this is a heavy season this year because of the number of ticks I'm pulling off of them and I see on them. So, what preventive measures, what can be done to avoid as far as being bit by these ticks?
Okay. So keeping in mind that the ticks are really small right now, the nymphs are very small, like specks of dirt.
Like
So-
the size of a pencil lead, just about.
Yes,
Right?
so you need to be really careful because actually you cannot see them when they're on you. So you want to stay away from piles of leaves, from brush, from high grass. And a lot of the folks that I've been calling, they're not hikers, they're not campers. They walk out in their front yard to, do their herb garden or whatever, and they end up with a tick-borne disease. So when you go in from working out in the yard, you want to shower within 2 hours with hot soapy water. You want to put your clothes in hot water for wash and then a hot dryer. Now, to prevent the ticks from even getting on you, you can use something called permethrin. It's a spray that you spray on your clothes ahead of time. And if you go out all the time, pick out a certain set of clothing, spray the clothing, let it dry, and it's good through 7 washings. So that's a good thing.
Oh, that's good information.
Well, it's insecticide, so it
Yeah.
actually kills the ticks, all right? So what I do is I wear rain boots outside when I'm doing yard work. I spray the rain boots, and I don't have a problem.
All right, so it's much like what a dog tick collar, how
Right.
that would operate.
The other thing you can do is DEET. Everybody knows about DEET, 20 to 30%, and put it on your skin. The problem with that is, I think, people forget when it's hot weather and sunny, they don't want to have something sticking to them. But yet it works as far as repelling ticks. It does not kill them.
Yeah.
So between those 2 things, and making sure you don't have big piles of leaves in your yard and high grass, you should be fairly safe from tick-borne diseases.
Okay, both of our offices also have available laminated tick identification cards. So, I mean, if people are interested in those, they can obtain or give a call, and we can get one out to you also. So, anything else you want to share on the ticks?
Yeah, just the medication. If you are on medication, it's for the tick-borne illnesses other than the viral, the powassan, babesiosis, you'd be on Mepron and azithromycin. In anaplasmosis and Lyme, you'd be on doxycycline. It's usually 10 to 14 days. Could be longer if, in fact, you have a couple of tick-borne illnesses.
Mm-hmm.
And actually, of the group that we've had in 6 weeks, we've had a couple of people who have had both babesiosis and anaplasmosis, or anaplasmosis and Lyme disease.
So a combination.
A combination. And doxycycline is fine for the anaplasmosis and Lyme disease, but if you have babesiosis and you don't know it yet and you're being treated for Lyme, you still don't feel well, you need to be in touch with your physician to be put on another medication,
To it.
Right.
So that the medication attacks that specific
Right.
tick disease. Okay.
The other thing, the old dog tick that we used to have years ago, that's still around, and you can still have Rocky Mountain spotted fever from a dog tick and tularemia. So, being bitten by a dog tick is not too much safer
Right.
than being bitten by a deer tick.
So best to avoid all.
All ticks.
So in those measures you spoke of with the treatment and clothing and what to wear, really protects you from all of
Right.
them at that point.
Right.
Okay.
But it's a lot of work because
Yes.
when it's hot in the summer on the Cape, you don't want to wear long sleeves. Not many people will. And you still want to be outside. Even on the beach you can get ticks, by the way. If you're by the dunes, by the grass and all, you can get ticks. So, this permethrin works really well.
So, and after a year of people being on guard because of COVID, they're kind of they're tired of being on guard. But, again, we wanted to share that message. We're seeing an uptick in the tick diseases,
Right.
and just kind of put an advisory out there,
People are really sick.
to be a lot more careful.
It's not like the old-fashioned Lyme disease where you were tired and, maybe a low-grade fever. These people are very, very
Well,
sick.
you have hospitalizations, you mentioned.
Yes, and one woman who I called last week told me she had COVID in April. She said she was sicker with anaplasmosis than she was with COVID.
Okay.
So something to keep in mind.
Good warnings.
Yeah.
Very good. The next summer health issue we're dealing with is everybody's out as the temperatures warm up. They're out at the ponds, the beaches, and we wanted to have a quick conversation about what's called, it occurs as the water warms, is swimmer's itch. And there's swimmer's itch is also called cercarial dermatitis, and we'll put a little chart up on the screen that shows the life cycle. It's basically a combination of, it occurs from duck feces and parasites that then develop through snails, water snails, or mollusks, and then the parasites transfer to the human skin. And you've gotten calls on that during
Yes.
the summers too.
Yes.
We're kind of given a warning ahead of time. We're not aware that it's occurring right now, but with the temperatures warming up, we're probably going to see it pretty soon. So what kind of calls have you gotten on that in the past?
Nothing so far this year. It's just that people call me when they have rashes at a certain pond and want to know if I've heard anything else about this pond, and should the beaches be closed? Should they do anything different, as far as when they come back from the pond? What kind of medication should they be on?
And so I guess it's, as far as with swimmer's itch, I've received those questions too. Shouldn't the pond be closed? The pond does not get closed. We do provide an advisory or inform the lifeguards, to just share that information. The lifeguards are our summer ambassadors down on the ponds, to share that information with people who are down there, or if they're asked questions or experience it. But the tendency is if you see some ponds with a lot of waterfowl, so if your kids are out there chasing the waterfowl away, probably a good thing. It just eliminates that the development of swimmer's itch at that point. But what ends up happening, as you said, is the rash. We hear from a lot of people that've been to the doctors. They get put on a medication to treat it, to knock down the parasitic infection, and then it does go away. But you can get reinfected from it as the summer goes. So just be aware of that as the water temperature warms. One of the things we're doing too is we're weekly. I had attended the Selectmen's meeting last week to discuss as far as our beach testing for bathing beaches. We test weekly, as is mandated by state law, for E. coli and enterococci at the saltwater beaches. All our beaches have passed the swimming standards to date. I'll be out this week doing another sampling round for this week's sampling. And that, with rain, the amount of rain we're receiving, that really can become sketchy based on road runoff and what comes off the roads into the ponds. So we'll be testing to make sure the swimming beaches are safe. And then the other one that we're all hearing about now is cyanobacteria. And that is cyanobacteria exists in all ponds at a natural, healthy level. It's just what circumstances affect a pond that causes exacerbation of blooms of cyanobacteria. We just put up a posting for Peters Pond as an advisory because they got tested last Thursday and they had a high count. And it's basically what it looks like is is green paint in the water, in the water column. So again, it is an advisory, and it's difficult, with this type of testing that, you take out a liter bottle and test for cyanobacteria, and you pull off the cyano on the top, the scum layer, and you look at it in the cell. You look at it through a microscope to determine the cell count, and what may occur in one part of the pond is not occurring in the other part of the pond. But we end up posting the advisory just to make people aware, and the best also is the visual, as far as looking for that green paintish scum that's in the water to avoid that. And so we'll be doing additional testing through the summer on that. And then as far as just an update on COVID, where do we stand with that in Sandwich at the moment?
Well, we've had 2 cases, I think, in the past month, unvaccinated people. We had a potential case this weekend of a person who tested positive, but in fact on 2 other tests was negative. So far so good. But my fear is with the Delta variant around and a large group of people unvaccinated, they're at high risk. The Delta variant is like 1,000 times more prevalent in the respiratory tract of people who unfortunately contract it. And people are sicker faster, like on the 4th day instead of the 6th day. And they are sick, very sick. So, you know, not so much for the youngest kids, but certainly 20s, 30s, 40s, 50s. So it's going to be a problem in the future, I think, and we're just...
It's a matter of just timing.
Waiting to see what's going to happen from the cases in the South that we see now.
So there's still the availability of vaccination.
Yeah, and that's a really good point. I wish people would just go and be vaccinated. The pharmacies have it, the Stop and Shop has it. If I had a big enough group of people, I have some that I can give as well. We can make arrangements for that. And I think it'll probably be FDA approved within the next few months, but still, I mean, when you look at the risks of getting the Delta variant right now versus the vaccine, it's no contest.
Right.
You know, the vaccine is so much better for you than getting COVID.
I mean, with the emergency approval and timing, I know that, you know, there's people concerned with that it hasn't had the full length of approval. At the same time, you know, the majority of the public was just vaccinated back, let's say, February, March, April, you know, that time frame. But at the same time, and this has been brought up before, that at the same time, you're almost going on a year now.
Yes.
As far as that you were vaccinated through the Moderna trial, and you're still here.
Right.
How you feeling?
I feel really good.
Good. Okay.
feel really good.
So in terms of you were in the trials and you're still all set, and they monitor you monthly.
They monitor me actually weekly. I have a diary I have to fill out, and they call me every week. And I have to go back in November for more blood work. In the NIH study, I need to do my blood work now. I can do it myself and send it in. So yeah. But you know what? I would not be surprised if they see some waning of, you know, your immune system, your antibodies. But remember, the T cells are another part of your immune system that help fight this infection. And we don't know enough about that yet to see, you know, how well that works. But maybe at some point we'll have to have it combined with the flu shot or maybe get a booster.
Like the swine flu H1N1
that
is now currently
in
the flu shot.
Correct.
Yes, so and that goes back to what, 2009?
2008, 2009.
Yeah,
right.
so, and that's still in the flu shot every year, so. All right, so I guess that's what we'll wrap up. Anything else you think we should cover, Joanne?
I hope not.
All right.
Yeah, I think we got more than
Very
enough
good.
right
So,
now.
I mean, we're doing, you know, I hope everyone's having an enjoyable summer. I know the weather's not that great, but we just wanted to give you an update. What's going on? Just kind of give you some heads up on the issues, precautions to take, and just awareness. So enjoy your summer, and we'll talk to you all soon. Thank you.